Understanding CPR and its significance might just save a life. Cardiopulmonary resuscitation, commonly known as CPR, is an emergency procedure performed in medical crises such as heart failure. When performing CPR, the aim is to mimic the pumping of the heart by manually compressing the chest, coupled with delivering breaths to aid oxygen circulation. Starting the procedure involves checking the victim's response and calling for medical help immediately. Place the heel of one hand on the center of the chest, the other on top, and push hard and fast. Aim for 100 to 120 compressions per minute. If you're trained, alternate between 30 compressions and 2 rescue breaths. Shock is another critical condition requiring immediate attention and can be life-threatening if not managed quickly. Signs include pale and clammy skin, rapid breathing, and weak pulse. It's paramount to reassure the victim, help them lay down with their feet elevated, and cover them with a blanket to maintain body heat. Avoid giving them anything to eat or drink, and monitor their condition until emergency services arrive. Understanding how to manage shock effectively can prevent severe complications. Choking can occur suddenly and requires prompt action. If you see someone clutching at their throat or unable to speak, they're likely choking. Encourage them to cough to dislodge the item. If unsuccessful, perform the Heimlich maneuver, stand behind the person, wrap your arms around their waist, make a fist, place it above their navel, grasp your fist with the other hand, and perform a series of upward thrusts until the object is expelled. Always follow up with medical personnel, even if the object is dislodged, to check for any internal injuries. Treating burns involves immediate care to reduce damage and alleviate pain. First, remove the person from the heat source. Cool the burn under running room temperature water to halt the burning process and reduce swelling. Avoid using ice as it can damage skin tissue. Cover the burn with a sterile, non-sticky bandage to protect against infection. For chemical burns, remove any contaminated clothing and rinse the skin thoroughly with water. Never apply creams, oils, or butter to a burn, as these can trap heat and worsen the injury. Poison emergencies can vary widely depending on the substance involved. If you suspect poisoning, try to identify the poison and call emergency services immediately. Do not try to induce vomiting unless instructed by a professional. If the victim is unconscious, check for breathing and pulse and administer CPR if qualified and necessary. Keep the person comfortable and watch for changes in condition. Having a first aid kit on hand is essential in these situations, ensuring you have gloves and other protective equipment to prevent further contamination or harm. In cases of heat stroke, move the individual to a cooler environment promptly. Remove excess clothing and use cool, wet cloths or ice packs around the wrists, ankles, armpits, and neck to help reduce their body temperature. Provide them with water or sports drinks if they're conscious and able to drink. Monitor vital signs, and if they show no signs of improvement, or if confusion, seizures, or unconscious house persist, seek immediate medical help. Knowing these first aid techniques is crucial for safety and can be life-saving in emergency situations.